Well, September is Sickle Cell Awareness Month, but having the disease certainly doesn't mean you can't live a normal life. And we're joined today by LaToya Webb. She is living with sickle cell. And we also have Dr. Josh Field from Blood Center of Wisconsin's Blood Research Institute. Thank you both so much for being here and talking to us about this. Doc, let me just start with you. Give us a quick medical definition of sickle cell. What is it and what challenges does it present?
Yeah, so sickle cell disease is one of the most common genetic diseases there are. In the United States, it predominantly affects African Americans, and people with sickle cell disease have sickle or crescent-shaped erythrocytes, or red blood cells, and these make it difficult for the blood flow to go normally to organs, so you can actually have damage to vital organs, including bones. So one of the most common problems people have is they can really have crushing pain when not enough blood gets to their bones.
And LaToya, why don't you put it in human terms then? What is this like for you living with this? And I guess since it's genetic, you have it your whole life, right?
That's exactly right.
I was born with sickle cell. I was diagnosed when I was 18 months. I had a lot of complications growing up. In my 20s, I had some brain aneurysms and things like that prevented me from fulfilling college. And so it was a little difficult, but I love what I do. I'm a para for NPS, and I mean, you just have to learn how to control the disease and control your stress level, and that helps a lot with managing the disease.
I was going to ask you, what are some of the techniques that you have to use daily to manage it and to keep a hold of it?
In the summer, it's imperative that you make sure you dress for the weather and you take care of yourself. You stay hydrated, you drink enough fluids, you eat the right foods, and you maintain your pain regimen. And in the winter, it's really imperative that you dress warm enough for the winter, because the extreme cold weather can make you really have a lot of sickle cell pain. So if you don't dress appropriately and control your diet and drink enough fluids, that can be really hard on your body.
Dr. Field, we're constantly researching what this disease is and how you can combat the effects. Tell us something that we've been learning recently.
So there aren't enough good therapies for sickle cell disease. So we have one drug that's actually approved by the FDA to treat sickle cell disease, but there aren't any others. So we've been working very hard at the Blood Center of Wisconsin and Frederick and the Medical College to try to develop new therapies. And we have one in particular that we're very excited about called regadenoson. So this is a drug that will give people like LaToya, she's received it, that the hope is it calms down some of the inflammation they have, improves blood flow, and makes the pain better.
And you also understand a benefit from blood donations. Can you give us an idea of why that is and what you're looking for there?
Right. So as you can imagine, when you have sickle cells that are affecting the blood flow, when you give somebody donor blood, it makes the disease much better. So we have individuals who get blood transfusions on a very regular basis, and these can be absolutely life-saving. The important thing is people like LaToya actually benefit from having blood that's donated by African Americans. So we're really trying to put a call out to the African American community to donate blood, because it can go to people like LaToya, and it really can be life-saving.
LaToya, thanks for sharing your story with us today, Doctor, for your research, and let's see if we can get some more people out there for you for your blood drive. Community Blood Drive, Saturday, September 14th, and it's from 9:30 to 1:30, Northside YMCA in Milwaukee. It's 1350 West North Avenue. And right now it is 12:43. Let's take a quick look outside. This is our tower camera in Waukesha. Michael Fish back with more details on this sunny but cool Storm Team forecast.